Michael Prohaska and his wife Ingrid say it's a miracle he's still alive. 2 years ago, he got diagnosed with a glioblastoma, a very aggressive, incurable brain tumor. The doctors gave him a few more months to live.
The doctor said he would not live till 2016. That was in the end of November. That's when I knew I'm running out of time.
Mr. Prohaska hardly remembers the night that turned his life upside down.
And then my wife told me that, apparently, I had an epileptic attack and that she had to resuscitate me.
The father of one had to stay in the hospital for weeks. It was a race against time. But then Ingrid heard about the opioid Methadone.
He was hardly able to talk. He could not walk without help. And I knew Methadone could help him. But no one was willing to prescribe it. No one dared to. And everyone acted as if it was an addictive drug.
Commonly used in substitution therapy for heroin addicts, some believe the drug could help destroy cancer cells, thus prolonging the lives of cancer patients. In December 2015, the couple found a doctor who treats his patients with Methadone.
And then he started taking drops of Methadone before chemotherapy had started. That saved his life, because the tumour was growing, even throughout radiation therapy.
I started with 3 drops of methadone, then 5, then 7, then 10, and now we are at the normal average of 32 twice a day.
That's Dr. Eduard Geisfuss. He's the doctor who prescribed Mr. Prohaska the drug, and one of a handful of doctors in Austria who trust its effect.
When I think about, for example, one patient with a glioblastoma who is still alive after solely taking methadone for 3 years, and there is still nothing growing back in her brain, then I think that's just great. If you look at the data, the average life expectancy, and how fast tumours like that grow back, then it is safe to say we achieve something for that patient.
He believes Methadone increases the efficiency of chemotherapy and his patient's quality of life. 20 to 21 months, that's the average life expectancy of people after they get diagnosed with a glioblastoma. Dr. Geisfuss trusts the substance could help up to 30% of them.
Of course, I've lost a significant amount of my patients with methadone as well. But I tell every patient I counsel that methadone isn't a wonder drug, but it is a glimmer of hope.
But how does methadone destroy cancer cells? The discovery was made by the German researcher Claudia Friesen about 10 years ago. She found out that cancer cells die when methadone is added to chemotherapy. Usually, chemotherapeutical drugs or antibodies just bounce off a cancer cell. However, methadone docks on certain opioid receptors on the cell. Because of that, the cancer cell gets porous. Thus, chemotherapeuticals can enter it and destroy it. The real sensation: the treatment should even work for tumors which stop responding to everything else. On the phone, Dr. Friesen tells me that she's had a lot of backlash ever since.
The water's up to my neck. I might have to stop my research if I don't get any funding anymore. That will be a catastrophe.
Why does no one support her? Methadone can be produced in every pharmacy. It has been used as a painkiller and drug replacement for decades. Right now, methadone can't be prescribed as cancer treatment. Instead, patients ask their doctors to prescribe it as a painkiller, that's so-called off-label use. A therapy costs only about £9 or €10 a month.
If you compare that to many other drugs we use in oncology, where the therapy costs a few €1,000s a month, there is no money to be made from it. On the other hand, clinical trials cost a lot of money, and that's probably the reason why we don't have these trials at the moment.
Dr. Geisfuss says clinical trials would be necessary to officially use methadone as part of cancer treatment. The problem: in Germany, about £5.3 billion for such research comes from pharma companies. And pharma companies show no interest in methadone. In Berlin, Professor Wolf-Dieter Ludwig tells me why.
What we've experienced in Germany in the last 20 years is that there is hardly any financial support for independent research on drugs. The reason why there is no clinical research on drugs such as methadone is obvious. Such research is not lucrative for pharmaceutical companies, since it is a drug that is cheap to produce and sell.
Methadone's biggest critics warn of methadone euphoria. They say the drug has significant side effects. High expectations are inappropriate. At the Charité hospital in Berlin, Dr. Martin Misch collected data of 27 brain tumor patients to find out if it's even safe to use the substance.
What we have found is that the main side effects are shown within the first month following the intake, which means that many patients suffered from sickness or obstipation. A few patients have psychogenic side effects, panic attacks or hallucination. Following the first month, there have been hardly any side effects.
Many doctors are intrigued, but they really want to know.
They want to know if we have seen an effect, but so far we have not seen an effect. We are not that far with our evaluation.
Mr. Prohaska did not have any issues, and he's certain it's thanks to methadone he's still alive.
It has improved. The tumour is receding. I won't stop taking methadone nonetheless, because there are still cancer cells in my brain. And as long as there is something, it's just like when you're cutting your finger. As long as it is bleeding, you will put a plaster on it, no matter how big or small the wound is.
Following recent hype in German media, a new trial was proposed. It should test 6 different substances, together with chemotherapy, methadone included. The decision about its funding will be made in autumn.